The days are getting shorter, the temps are getting colder, and our moods are getting bluer. Many people find themselves feeling down in the winter, particularly after the excitement of the winter holidays are over. The winter blues is a general term people use to describe a mild sadness that usually passes after a short amount of time. Seasonal affective disorder, or SAD, is not just the winter blues. It's a clinical diagnosis for a type of depression that follows a seasonal pattern.
Well, the technical definition of seasonal affective disorder is that it has to occur for 2 seasons. It usually starts late fall going into early winter, and it has to occur for at least 2 years in a row. 2 other criterion are that there's no specific event that might precipitate it, such as a death in the family or something like that, and also that the symptoms go away in the springtime.
The specific cause of seasonal affective disorder is unknown, but we know that there are several factors involved. One factor is light exposure, or rather the lack of light exposure as the days grow shorter. Light affects our mood and our circadian rhythm, which is the internal clock that influences our sleep patterns. SAD patients also experience a drop in serotonin, a neurotransmitter that affects mood, and melatonin, a natural hormone that affects sleep and mood. It's no surprise that many describe SAD as a sort of tired, sluggish hibernation.
So the symptoms of seasonal affective disorder, or winter blues, really run the range of symptoms of depression. You might feel blue or sad, down in the dumps. Your sleep rhythm might be off. It may be more difficult for you to sleep. You have a lack of energy, loss of interest in things. Your concentration might be affected. Your ability to enjoy things might be affected.
It's normal to have a few blue days once in a while, but when you feel sad for weeks at a time and it begins to affect your daily living, you should see your doctor. Once diagnosed, there are treatments that can help.
One is to actually increase exposure to light. So try to go outside during the day, try to perhaps sit next to a window, get that exposure to light. They also have light boxes, so there's something called light box therapy that's available commercially, where people just put it on and you get this exposure to light, and that seems to have a beneficial effect.
Light exposure triggers our circadian rhythm, so it's important to get light in the morning. It gives you an energizing boost and tells your body that this is the time to be awake and alert, not tired and sluggish. At least 2 hours of daily light exposure a day can make a difference.
Another approach towards treating winter blues is medication. So sometimes antidepressants like Paxil, Zoloft, Prozac, Effexor. These are all antidepressants that are commonly used for seasonal affective disorder. And finally, the third approach is cognitive behavioral therapy, where you can learn how to change negative thoughts into positive thoughts. This is a very important approach towards treating seasonal affective disorder. Seeing the cup as half full, seeing things from a more positive type of way, learning to enjoy things, being involved, treat yourself to something that perhaps you wouldn't normally treat yourself to, and trying to be happy, trying to joke around with people. Sometimes watching something humorous on TV can go a long way towards helping you feel better.
There are several risk factors for seasonal depression. It's genetic, it's more common in women, and it's more common the farther you live from the equator. If you're at risk, have a history of seasonal depression, or just want to avoid the usual winter blues, there are a few tricks you can try to prevent it.
Making sure that you get enough exposure to light, going outside, taking a walk during lunch, exercise, physical exercise, extremely important during the whole year, and particularly during the winter. It seems to kind of get us more energized and helps you feel better. It releases endorphins within the body. And doing all the coping techniques that, in terms of how you might cope with being depressed or being down. Speak to a friend, go out with friends, watch something humorous, try to enjoy yourself, socialize. Don't kind of withdraw into a cocoon and just get yourself out there.
If left untreated, seasonal affective disorder can lead to clinical depression. It's important to recognize the signs and symptoms and seek medical assistance if the symptoms progress. When the skies inevitably turn to that sunny spring blue, you don't want to be hanging on to your winter blues. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.